welcome to The Other Side. On behalf of George Willey, I'm Farah Kilidar, CEO of the World Affairs Council. And I'm sitting today with Bobby Robbins, CEO and President of the Texas Medical Center. Welcome, Bobby. It's good to see you here. We're actually sat in your office today, surrounded by lots of photographs. So I will take that to ask my first question, to really have you tell us a little bit about yourself and where you grew up, and more on the personal aspect of Bobby.
Well, I grew up in a small town in South Mississippi, and I was raised by my maternal grandparents. My grandfather was a math professor at a small junior college, community college in South Mississippi, and so I had all the good fortune of growing up on a small college campus and around a lot of interesting people and sports, and then went on to go to a small liberal arts college in Jackson, Mississippi called Millsaps, and then medical school across the street at University of Mississippi, and surgery training, and then to New York City to work at Columbia, then NIH in Bethesda, Maryland, then to Stanford, where I thought I'd stay the rest of my career.
And in fact, you were in Stanford for about 20 years, am I right?
Yeah, a little over 20 years.
Okay, and that was right up to your move to Houston, Texas.
That's it.
What made you take this leap, in essence, to come here to the Texas Medical Center?
Well, I'd had an incredible time at Stanford, and was very fortunate to be in several leadership roles there. But after years of being sort of at the cutting edge of cardiothoracic surgery, I was looking for other opportunities to be able to grow and have even a bigger impact on the improvement in human health. So I looked at several opportunities, deans of medical schools, and this opportunity came about, and I had known about the Texas Medical Center since growing up in small town Mississippi, because most of the people that had the resources to travel to Houston who got cancer or had heart disease either came to get operated on by Dr. Cooley or DeBakey for heart disease, or came to MD Anderson for treatment of cancer. And over the last 25 years, I had looked at a variety of jobs in the institutions of the Texas Medical Center, but had never stepped back and thought about the entirety of the medical center. So when the opportunity came about to really have just one purpose of what I was supposed to do, which was try to get the institutions to work together in a more collaborative and cooperative way. I knew that was going to be somewhat of a challenge, but it's turned out to be one of the most rewarding times of my career. It's been a lot of fun.
That's wonderful. And for those people who don't really know enough about the Texas Medical Center, it's, I think you were quoted as saying it's really more of a city than a medical center as such.
It is.
Can you tell us a little bit about the history of the medical center?
Well, the medical center started because MD Anderson, who was a cotton broker from Tennessee, who made great fortune as part of the Anderson-Clayton Cotton Exchange, as he was winding down in his later years of life, he had no heirs. He was never married, and had amassed what in those days was quite a fortune. He started a foundation to do good deeds with his fortune after he was gone. And the trustees, there were 3 trustees of the foundation, settled on the idea of creating a medical center in Houston. Dr. Bertner, who was actually the first president and CEO of the Texas Medical Center and the only other physician in the 70-year history to hold that post before me, convinced a couple of attorneys that it may be a good idea to create a world-class medical center. At the time, Houston was emerging as a internationally, economically impactful city with the with the energy industry, particularly having discovered oil several decades before, and with the ship channel and all the, the opening of the Panama Canal a few years earlier. Dr. Bertner thought that it was a needed entity in the city to create a medical center, but he had a bigger, different idea, which was to get several hospitals and several institutions to come together. So the foundation petitioned the city to buy a couple of acres from Herman Park, and there was a public referendum, and it passed, and the land was deeded, and the Texas Medical Center Corporation was started, and they say the rest is history.
And in fact, we are sat on Bertner Street, aren't we?
That's right.
Which is really the TMC headquarters.
Right.
It is really interesting because the medical center does seem to have a lot of history and very interlocking history as well. But even from day one, as you just pointed out, partnership seems to be really the premise on which the medical center was even set up. And you have sort of taken that premise to a whole new level with your move here in 2012. I'd like you to tell us a little bit more about your vision for the Texas Medical Center and where you see it 2 to 3 years down the line.
Well, I think you hit on an important point. When it was started, there were few institutions, MD Anderson, Baylor College of Medicine, then Methodist Hospital, and of course the longtime partnership between Methodist Hospital and Baylor College of Medicine, and then St. Luke's and Texas Children's. And so in the early days, I think there was a lot of collegiality and cooperation, certainly between Methodist and Baylor in those early days. But as the institutions gained more success and continued to grow, the inevitable competition developed. And competition's a good thing. It keeps everyone sharp and on their game. But now in a time when, particularly around the research area, when these big financially intensive projects like surrounding genomics or stem cells or imaging things, the equipment is evolving so quickly and it's so expensive that this era of big science requires cooperation and collaboration. So that's really what we in the early days, through a strategic planning process, got the institutional leaders and the stakeholders together to map out a plan, a roadmap for the medical center over the next 5, 10, 15 years. And that's the idea that the Texas Medical Center has this massive clinical operation. If you look, it's the largest concentration of clinical activities on one single campus in the world. And there's also a huge research component. With extramural funding, if you look at just one campus, again, it's the largest in the United States. So the thing that's missing is the translation of those fundamental discoveries, of which there are many significant fundamental discoveries over the history of the medical center that's really changed medicine and improved human health. But most of the translation of those discoveries have been exported to the East Coast or the West Coast, where they were developed into startup companies, and then commercial partners were brought in, or either they grew up and became big enough to do a new drug, a new medical device on their own. So one of the things that we had hoped to do was create the ecosystem and the infrastructure to allow the translation of fundamental discoveries into commercializable products right here in Houston. And so that's an exciting area and something that we're really focused on as we're building out the translational research campus here that we're calling TMC3.
And that's wonderful. So in essence, historically, all those ideas were being developed here, right here at the Texas Medical Center, but were being taken usually by the East Coast or where companies were developed, and now we're hopefully looking at the production, manufacture, and sale of those medical products taking place right here in Houston. And in fact, part of the reason why we're doing this interview is to really highlight the fact that the World Affairs Council will be honoring you as our 2016 International Citizen of the Year, the Jesse Jones Award, as we call it. Can you tell us a little bit more as to how you got some of the foundations and the families that have participated in contributing to the medical industry here in Houston, how you got them on that same page?
Well, I think that happened before I was ever hired. In the Houston Endowment, of course, is a major philanthropic source in Houston, and of course is the foundation that was started by Jesse Jones, who was a true visionary and civic leader here for decades. So the Houston Endowment and the other big foundations, I think, approached our board and said, the latest and greatest imaging equipment or sequencing machine or some high-priced item, we get requests to fund those from all the institutions, and they thought about, well, why can't you guys get together and share some of these very expensive new machines and technology? And of course, there was not a lot of success in messaging that. There have been, collaboration goes on in the medical center every day, but it's usually at the professor and postdoc level. At the highest levels, there have been somewhat resistant to come together and collaborate. But there are emerging examples of the institutions coming together for mostly around research and educational projects. But I would envision as time goes on, there will be cooperation on the clinical side of things. There's certainly in the area of quality improvement, so making sure that patients are treated safely, that they have the best outcome that's humanly possible. There's a lot of sharing that goes on about protocols and algorithms for taking care of patients, whether it be the one that comes to mind most recently is Memorial Hermann and St. Luke's and Methodist coming together to talk about their protocols for treating patients who have sepsis or a bad infection. So those things go on a day-to-day basis. But I think that there was a great desire from the philanthropic community, primarily highlighted through the large and very generous endowments and foundations, to get the institutions to come together, because I think that working together, one could envision that the foundations would give more money than they would to the individual institutions. So that's sort of the premise of what our plan has been, is that the sum of the parts is greater than the individual parts, and that teamwork is something that will each of the institutions will be rewarded more as part of a team, because there are going to be more grants that are given, not just from the endowments or the foundations, but from NIH, NSF, Department of Defense, DARPA, and really the issue is how to more effectively and to more efficiently make those discoveries, translate them, as I keep saying, to improve human health. That's the ultimate goal.
Absolutely, absolutely.
So it was already decided before I got here, so my job has actually been easy. Well, it's sort of, as they say, a consultant, someone who comes and tells you what time it is on your own watch. They knew all this. Right. They just needed a community organizer to bring them together and be that neutral party and safe harbor where they could come together and work together. Because as I've been told, had it been one institution trying to lead the others, there would have been some resistance. But because we don't compete with any of the institutions, then we could be that convener.
On August 25th, Asia Society Texas Center holds one of the most powerful women in the world, Lulu C. Wang, as part of its Women Leadership Series. To purchase tickets, please visit asiasociety.org/Texas.
On The Other Side, we interview a variety of people and seek to examine their beliefs, their opinions, and their passions. Then we invite them to come with us to the other side and look at the antithesis of their views. What comes out is an in-depth conversation without the vitriol of the talk shows, but a cerebral engaging of ideas you will not find anywhere else. Come join us on alternate Saturdays on this channel. If you'd like to recommend a guest for The Other Side, contact us at the email address on the screen.
A little known fact, speaking of collaboration, is the fact that the TMC actually works with international governments as well. And it's not hard to see, of course, when you walk around the medical center or any of the hospitals here, that there are a lot of foreigners that travel to Houston for the purpose of attending one of these hospitals. Can you tell us a little bit more about both aspects of the medical center here?
You know, the medical center was really built on two large pillars, cancer treatment and cardiovascular care. So, you know, really Dr. Cooley and Dr. DeBakey were pioneers who, as was MD Anderson, in the treatment of cancer and then cardiovascular disease on the surgery side. So there were people from all over the world who used to come here to get treatment in the 60s, 70s, and even into the 80s. But in terms of starting to, I think we're in a phase now of working with other countries, particularly Australia and China. We've been focused on from the TMC Corporation side more recently, because we think there are a lot of opportunity for exchange of ideas and joint collaborative programs around research and education. There is a very ambitious plan to build in Beijing a Texas Medical Center-like complex that will be twice as big as the Texas Medical Center. We've grown to over 50 million square feet of developed space, 57 institutions, over 70 years.
Right.
And there's a very aspirational plan by the Chinese government to build a replica, if you will, of the Texas Medical Center, but twice as big in the next 3 to 5 years. So they've asked us to be involved in this. And of course, we want to be able to help any way we can. It's a little bittersweet, because then we won't be able to say we're the largest medical center in the world anymore.
Right.
But we're working with them on joint research and educational exchange programs, particularly around genomics and stem cell biology and regenerative medicine, but also working to make sure that there are the patients that are deemed appropriate would come to Houston and the Texas Medical Center to be treated.
And of course, I mean, irrespective of, you know, the size of a medical center, be it in China or Gulf states or whatever, the research aspect of the TMC, you know, you're already 70 years ahead, so that's not something that's going to be able to be replicated in 2 or 3 years. But taking on the Australian example, where you're hoping that they'll, you know, Houston will be the next place for them to come, would that be where they would utilize TMC3 when they come here and try and collaborate? Is that the idea?
That's right. So we started with this Innovation Institute, and I wasn't patient enough to wait for TMC3, which will be the ultimate location for these signature programs. So we converted about 100,000 square feet of space in the old Nabisco cookie factory across from the VA and built out an Innovation Institute, and we're lucky enough to attract Johnson & Johnson J Labs there, and the AT&T Foundry, which is the first dedicated digital health innovation center that AT&T has. we're about to announce a major expansion with Johnson & Johnson here. We've got a great program that's just starting with Apple Care, Apple Health here, with Baylor and Methodist and other institutions working together to deliver care through devices outside the hospital. First starting with cardiac surgery patients and then moving to congestive heart failure, diabetes, chronic obstructive pulmonary disease or emphysema, and then particularly interested in a program around adolescent mental health. So we're excited about all these companies who are now coming to Houston and the Texas Medical Center to work with us. And the project called TMC3 is really a collaborative between partners, MD Anderson, University of Texas, Houston Health Science Center, Texas A&M Health Science Center, and Baylor College of Medicine, and also Rice University. And I'm sure that some of the hospitals like Methodist and Texas Children's, even University of Houston, will participate in a smaller way. But those four founding anchor tenants of the TMC3 development are very exciting. And this campus will be a campus where there will be four major institutions building significant, 300,000 to 500,000 square feet research facilities, and will be connected to a really iconic double helix structure in the middle, where there'll be shared facilities for imaging, for cell sorting, for high throughput drug screening for discovery of new drugs, bioinformatics, a digital health platform that will manage data to help develop new insights about the intersection between genomics and phenotypic data to make predictive and personalized care plans for patients. So we're really excited about that, and it gives us an opportunity to have all the ingredients of a successful life science cluster. The fundamental one is to have great research, which we have, and then the amenities of shared core facilities, to have hotel and conference center, to have housing on this new campus, to have restaurants, bars, retail stores, and then finally to have space for companies like Johnson & Johnson, like Medtronic, like Merck, Pfizer, Amgen, Amazon, Google, Apple, who have not traditionally been in the health field but are making a major push. To have them all side by side working with our researchers to co-develop new drugs, new devices, new diagnostics, new digital strategies. We think that's very exciting and really gets the attention of the global community, whether it be venture capitalists or companies or investors that would come here to Houston. And I think that's going to be the next big development for the Texas Medical Center. We're very excited about it.
Of course, and actually speaking of venture capitalists, when you go to the West Coast, the venture capitalists are there, be it you're speaking of the IT industry or medical and so on. Is that an area that is still lacking in Houston, and are we looking to be attracting those through that same project, the TMC3? Yeah,
the capital is lacking. There are a couple of venture capital firms here that do invest in Houston companies, but ironically, several of the venture capitalists in the life science area have not chosen to invest here. So we're hoping to change their mind about that as we build out this infrastructure, but really to bring in venture capital firms. We've been successful in bringing some smaller ones here, but some of the big players on the West Coast, particularly in the Bay Area or in Boston, that we believe that one of them will think that there's enough activity going on here that they'll open an office in Houston. And once that happens, then the others will potentially do the same, because there's so much deal flow and so many opportunities here. But equally as important is the management talent. You know, in the Bay Area, if you had a startup company, you could open your Rolodex and find, you know, 5 to 10 people who could be the potential CEO, CFO, Chief Scientific Officer of a company who had regulatory experience or manufacturing experience. And we just don't have that critical mass here in Houston. We think that TMC3 will help attract people and overcome some of those barriers.
Right, wonderful. Before we wrap up, I'd like us to sort of swerve back to the personal aspect of Bobby Robbins. And first ask you how you found your first year here in Houston. You know, Houston is a very different place from the West Coast. And you know, how you found the people as well as the whole industry in your first year here.
Well, everyone, you know, when I was leaving the Bay Area, asked me, how in the world are you going to survive the weather and the heat? And, you know, of course, I evoked the Mark Twain quote and said, I've been freezing to death, you know, every summer in the Bay Area for years. And having grown up in Mississippi, this was, you know, a climate that I felt comfortable in, and I much prefer warmer weather to colder weather. So the transition, weather-wise, was not that big a deal because, as I say, you know, it's 68, 70 degrees, whatever it is, with the air conditioning everywhere I am most days. But more importantly, I found Houston, and I sort of knew this before I got here, to be a very welcoming meritocracy. If you had good ideas and were willing to work hard, you could be successful. It's also a very entrepreneurial and pioneering culture and city. And I think that comes from risk takers betting that there's, you know, oil or gas in that piece of land and going for it. So I see that it's very similar to the Bay Area culture, that we share a lot of the same entrepreneurial, pioneering qualities. So it's been an incredible blessing to have had the opportunity to be here, to work with so many great leaders and talented people, and I'm just excited about what the next 4 or 5 years have for us, because I think you're going to see a real change in certainly the medical center, and it'll help the economy of the city, it'll help diversify the city, and we, you know, as I alluded to early on, we think that we want to be not only the largest medical center in the world, but the best medical center. And I think some of these things are going to help us achieve the very aspirational goals.
And I have no doubt you'll achieve that. I wish you all the best. It's been a pleasure sitting down with you today.
Oh, it's been so much fun. Thank you so much for coming over and talking with me.
Absolutely, and we look forward to celebrating you on September 13th.
Well, thank you so much.
Thank you, and thank you for joining us for The Other Side.